We are back on Taking Care of Business on Koerner Radio, News Talk, 1180, 1230 KGEO, 1410 KERI, and now in New Mexico on KKIM. And poor Clay is biting at the bit. This is his favorite subject. Go, Clay.
Well, one of the things I wanted to just touch on, Sally, is 30 years I've been in the healthcare business, and I built up a nice retirement, and as thousands and thousands of insurance agents across the country have done. And now we don't have a retirement plan. We are totally destroyed because of Obamacare. And I'm not sure what we're going to do. Any suggestions?
Well, I mean, I think we really need to keep the American people abreast of what this legislation is going to do to their health care, and really focus on the repeal of certain parts of it. The court cases are very, very important because people just don't realize what it's going to mean for their long-term health care, what it's going to mean for their retirement if we don't make changes to this program. And so I just think, I don't want us to be, as I said earlier, on the road to serfdom and on the way to a Medicare for all program. People should be in charge of their health care. People should be in charge of their retirement, and they want to feel comfortable in their retirement. And, if you retire at age 65, back in 1965 when Medicare came into being, the average life expectancy was 65. Today, the average life expectancy is 79.5 years. So if you retire at 65, you've got a lot of years of being, if you opt to take Medicare, a lot of years of being on the program. And that's why I think, the cost estimates have been way under, and why the CBO is now saying that, this program will be bankrupt by 2024 at a cost of $1 trillion.
Well, it's not going to go that far because you've got the Life and Death Committee.
Right, exactly. And the rationing that is going to happen when under the Obamacare, we have, 3 agencies that are, I think, going to ration care, starting first with our seniors, one being the Independent Payment Advisory Board, this 15-member board that will be appointed by the Senate and approved by the Senate to look at the costs of Medicare, both by doctors and the hospitals, and then and it will ultimately result in ration care, because the only way this is the only way it's going to work to cut costs. The second is the accountable care organizations, which will reward doctors and hospitals if their costs come under for treating Medicare people on what they project. If they come in over, doctors and hospitals will have to reimburse the government. The third is PCORI, the Patient-Centered Outcomes Research Institute, which is going to be looking at comparative effectiveness research, which drugs and medical devices and treatments for seniors are cost-effective as compared to medically effective, patterned after NICE in the UK, the National Institute for Health and Clinical Excellence. These are 3 bodies within Obamacare which are really going to end up, I believe, rationing care for our seniors.
It's funny, Sally. One of the things I'm involved in, Clay's more involved in the health end of it. I'm more involved in the P&C end of it. But I teach the long-term care classes that agents have to have. And before Obamacare was even an issue, long-term care was the elephant sitting in the living room, because it could explode the system with our generation, retiring now and living longer. With Obamacare, it's going to be an absolute disaster because there's no provisions for it, and it's going to overload Medi-Cal. If we didn't even have Obamacare as an issue, and nobody's talking about long-term care.
I know. I mean, and under Obamacare class, the Class Act, Secretary Sebelius could not make it work, and so
they dropped it.
They dropped it,
but they haven't removed it from the books, and I would really like to see it repealed. But they just can't make it work, and people should, purchase their own long-term care in order to take care of, after they're retired, and of course, people tend to think, well, I don't want to think about that, but it is very important for people to purchase long-term care insurance in the private market.
If it's available.
If it's available. I want to ask you and Clay both a question, because this is more your issue than mine in a way. But one thing I've noticed is we're seeing rationing already with doctors because, specialists are leaving the marketplace because there's no money in it for them anymore. In Bakersfield, for example, I think we've got 2 endocrinologists, which is outrageous for 400,000 people. And do you see doctors retiring? I think there was a survey I saw not too long ago where 40% of the doctors said that they would retire if Obamacare passed.
Well, yes. I mean, the Investors Business Daily did a survey saying 45% of doctors that they polled are seriously considering getting out of the practice of medicine because of Obamacare. There has been a lot of other studies that have come out recently. The Physicians Foundation has done a survey of docs under 40 and shown that, of those, 49% of doctors under 40 say that PACA, that Obamacare, will negatively impact their practice. 57% said they're not optimistic about the future of medicine under the Affordable Care Act, so that's very discouraging. Deloitte Touche said 73% of doctors are not excited about the future of medicine, and 69%, this is very important, think that the best and the brightest will not consider a career in medicine. So not only are we going to see a lot of doctors retire because of the rules and regulations under the law, but we're also going to see, I believe, that the best and brightest are not going to go into medicine.
We're having a conversation with the author of The Pipes Plan and the Truth About Obamacare, Sally Pipes.
Sally, since we're now in New Mexico on a station there, what can you tell us about the New Mexico exchange that might be of interest to these people?
Right. Well, I was in Albuquerque and in Santa Fe about 2 months ago, meeting with people in Santa Fe with the Secretary of HHS, and then I gave a speech to people in Albuquerque as well. And Suzanne Martinez was trying to decide whether or not they were going to set up an exchange, and I actually don't know what they decided. There are, in fact, on the exchange issue, as of last Friday, December 14th, states had to decide whether they were going to set up a state exchange, a federal exchange, or a partnership exchange. And so we have 20 state exchanges being set up, 22 with feds, and 7 partnership states. I've been pushing for states not to, and I recommended this in New Mexico, that states should not set up their own state-based exchanges and see how the feds are going to handle this, because I don't see how they're going to be able to afford it because there's no money in the bill for funding the federal exchanges. So I need to check in on what's happened in New Mexico, but it's a small population in a fairly large state in New Mexico with a fairly high Medicaid population. So they've got some tremendous cost issues. So I'm hoping that they decide not to set up the state exchange there.
Well, I agree with you. I hope they don't as well. California tends to lead the charge on that, and California's already had a couple of failures. And now what's going to happen with the California exchange? You think it's going to be successful?
No, I think it's going to cost a whole lot more. I mean, they're estimating it to cost about $210 billion. It's probably going to cost a lot more than that, and it's really not. It's going to be a very costly disaster.
Now, are there going to be 2 different exchanges, one for for people that are not in a group plan, people that are in a small group plan, or people that are in a large group plan?
Well, the exchange is set up for individuals and people in small business. So I don't know exactly. I think there's going to be one exchange, but with 4 different types of plans available to people: the bronze, silver, gold, and platinum. And so that's going to be how it's set up. So
going back to the employer that pays his $2,000 fine and says, "Here, guys, go and enjoy." They're going to be able to go into the same exchange and buy any one of those 4 options. Right, exactly. But I think they're going to be very surprised at how expensive the options are. I think they thought they were going to get a really cheap deal, and it's not going to be cheap because, as I said earlier, the essential benefit plan is going to make it much more expensive, because the more mandates that you add onto an insurance plan, the more costly it is. And we know that there are about 2,200 already mandates on insurance companies across this country. Most states have about 4,950, and they add 20 to 50% to the cost of an insurance plan. If I want a plan, that doesn't cover chiropractic hair prostheses, I should be able to get it. But right now you have to purchase it with all of these mandates,
and it makes the insurance more expensive, and particularly for young people, they make a decision not to buy insurance.
Like tattoo removal.
Yes, exactly.
I mean, that's a benefit.
Cost and painful.
That's a benefit in some areas. Well, again, back to the entitlements. If an employer gives a group benefits, then I understand that the employee cannot get a subsidy. But if he leaves the employer and goes into the exchange, then he can get a subsidy. Is that correct?
Yes, it is. And so, as I said, anyone between 133 and 400% of the federal poverty level, a family income up to $94,000, will be able to get a subsidy. But, the higher your income, the lower the subsidy will be. It's based on a sliding scale. So, and then below that, you'll be covered under Medi-Cal in California or Medicaid, and which we've talked about. I mean, I think people are going to be very, very surprised at how the kind of health care they thought they were going to get will not be available to them, and how difficult it will be to find a doctor under the Medi-Cal program.
Sally, again, time runs so fast when we're with you, and I really, really appreciate the time. Clay's playing with
his new toy.
His new toy. Sally, thank you very much for being with us, and Merry Christmas to you.
and to you both. And we look forward to chatting in the new year. And I hope that you'll be attending our Steve Forbes dinner in Newport Beach on February 20th. We will definitely talk to you about it. We'll see you in 167 hours on Taking Care of Business on Koerner Radio News Talk 1180.